The Center for Advancing Opportunity within the Thurgood Marshall College Fund supports research in removing barriers and creating opportunities in fragile communities. According to their latest study, those most impacted by COVID-19 in the DC metro area cited drug or alcohol addiction as one of the three biggest barriers to improved financial situations. Dr. Howard Henderson, director of the Center for Justice Research and one of the researchers on the study, explains why.
What's happening is that because of socioeconomic barriers, because of income, because of education, individuals are challenged. And so we have found that because of those challenges, they turn to drugs and alcohol abuse. And so if you look around the country, you now see a rise in opioid addiction. And so we have issues that we're not thinking about that we need to be able to address. And this report kind of helps you unpack some of those realities.
Researchers say it's too soon to have definitive data on the pandemic's effects, but according to the recent analysis of 500,000 urine drug tests by Millennium Health, a national laboratory service, the trends are concerning. Their data shows an increase of 32% for non-prescribed fentanyl, 20% for methamphetamine, and 10% for cocaine from mid-March through May. According to a national tracking system run out of the University of Baltimore, suspected drug overdoses climbed 18% in the same period. Can you talk to me about the other barriers that people named as limiting them from being able to achieve financial success from the report?
A lot of individuals said that they felt that they lacked opportunities for adequate employment and housing. They felt that that was very important for career advancement. And they said that the number one barrier to economic improvement was the ability to climb the ladder in their job. It's very important because they felt like they were locked into a position that they were unable to overcome.
Is there anything going on right now in the government that you think, if I could get this work in front of this group of individuals, we would see the most dynamic change?
I think when you're talking about criminal justice reform, which we haven't talked about so far, 52% of the Black fragile community members in our report and almost 60% of the Hispanic members felt like they want police to spend more time in their community. Now, that falls counter to what the national narrative has been, but what that means to us is that though these communities oftentimes have a negative experience with the police, they want more police there, which means they want a different type of policing in there. So we can get that information into the hands of the policymakers from the local level, from city councils to mayors to police chiefs, all the way up to congressional policymakers. Then that can make a difference because that is a natural argument for a reallocation of resources in American policing to be more effective.